The following program is brought to you by the Center for Educational Outreach at Baylor College of Medicine.
Welcome. My name is Ron McNeil, and I'll be your tour guide today as we look at anatomy of the heart. We're going to break it down into two phases. One, we will look at the external landmarks of the heart. Then we will look at the internal landmarks of the heart. Our model today will be the sheep heart. One of the reasons we chose the sheep heart is because it closely mimics the human heart. First thing we're going to do is take a look at the external features of the heart. If you purchased your heart from a commercial source, this is basically what it's going to look like. And if you notice, you really can't tell a whole lot about this heart because it's covered in all of this white. Can't hardly see the vessels. What you're going to need to do first of all is to trim the heart. You're going to need a pair of scissors, and what you're about to do is by thin layers, very carefully, trim away the fat or the white area that surrounds the heart. And as you pull this away, you're going to begin to uncover all of the features of the heart. How do you know when you've gone too deep? This coloration right here is the actual cardiac muscle, the heart. All of the rest of that white is the fat that can be trimmed away. The heart that I trim that we will use for external landmarks took me about 45 minutes to an hour. That preparation time is very important if you want to have a successful viewing of the external anatomy of the heart. What I'm going to do now is switch to my trimmed heart. And you can see that there's a lot of difference between a trimmed and an untrimmed heart. So spend the time. It is well worth it. So as we look at this heart, we notice several things about it. It has vessels, it has lobes, and it has a heart shape. If we wanted to orient ourselves to this, we need to know what is the front and what is the back of the heart. Notice on the heart there is a pretty flat surface on one side of the heart, and then if you turned it over, you're going to have a more rounded surface or a surface that has a ridge in it. The flat surface that's relatively flat is the back side of the heart. We call that the posterior heart. That means that the other side that has the ridge on it is the front side of the heart, or the anterior heart. Let's look first at the front of the heart for one more detail. That detail is the tip of the heart. We're looking at the anterior or front side of the heart, and we see a tip. That tip is called the apex. So if it were sitting in a person's chest, it would be tipped a little bit to the side like that. The apex pointing a little bit more to the left than straight up and down. So that's our orientation. The next thing we have to do is to talk about left versus right. As you're looking at this heart, of course, this looks like your left because it's on the left side of your body. However, anatomically, this is the right side of the heart. So be sure and keep those orientations in your head. You always call left or right based on the anatomy of the heart itself. Now, from the exterior, we can see four things. As you well know, or some other landmarks. As you well know, there are four chambers in the heart. So let's get a slight orientation as to where those chambers are. We're on the anterior side of the heart, and we're looking at the top of the heart. This area right here, this is called the left auricle, or left chamber. Under it is the atrium or chamber. This empties into the largest of the chambers, the left ventricle. On the other side of the heart, the anatomical right side of the heart, we have the right ventricle, and at the top we have the right auricle. So there are your four basic chambers of the heart. What I would like to do is to show you the vessels and the flow through the heart so that you can walk through circulation of the heart while we're looking at the external features. If you will turn your heart over, you will find that there is an opening that goes into this little dog-eared area. That opening that I actually have my finger in right now is called the superior vena cava. The superior vena cava is the vein, the main vein that drains the head, neck, and shoulder region, and it brings it back to the heart. Just below that is another opening, which is called the inferior vena cava, right here, the one that I have my finger in. The inferior vena cava drains all of the lower body, bringing it all back to the heart. Both of those vessels, the superior vena cava and the inferior vena cava, empty into the right atrium. Now, what we see from the outside is this dog-eared looking thing that we call an auricle. But the chamber inside, what I have my finger in right now, is the right atrium. Now, think about this. The veins are bringing all of the blood back from the body, and that blood that is coming back into the right atrium has low oxygen. So the whole purpose of the heart is to keep it pumping through the body and to get oxygen for the blood. So the blood enters the right atrium, then it goes through a valve down into the right ventricle, this area right here. From there, it is pumped through the pulmonary artery. There is the pulmonary artery right there. The pulmonary artery is going to come up and split, with one going to the left lobe of the lung, one going to the right lobe of the lung. In the lung, it's going to pick up the oxygen and give off the carbon dioxide and come back to the heart with high oxygen content. If we turn our heart over again to the posterior side and look on the left side of the heart, we're going to see another large opening right here. That opening is the pulmonary vein. It is returning from the lung with highly oxygenated blood. The pulmonary vein is entering the left atrium. From the outside, we see that other dog-eared flap, which we call the left auricle. But inside there is the chamber called the atrium. Once that blood enters the left atrium, it goes through another valve into the left ventricle. From there, it is pumped through and out of the heart through the aorta, the largest artery in the body. Now, what we're seeing here are two branches of the aorta. The blood leaves here, splits. Some of the blood goes to the top part of the body. The rest of the blood goes to the bottom part of the body, so that now oxygenated blood is sent throughout our entire body. That whole cycle will repeat itself with the low oxygen blood coming back again to our right atrium and beginning that process of oxygenation all over again. Now we're going to look at the internal landmarks of the heart. Again, orient yourself. Remember, the flat side of the heart is the back or the posterior side of the heart, and the other part of the heart, the other side of the heart, usually has a ridge on it, and that would be the anterior side. And again, we have the tip of the heart, which is the apex. What you want to do with your dissection at this point is to take a pair of scissors, such as these, and find that superior vena cava on the back side of the heart. Once you find that, what you want to do is simply cut down through the heart along the middle of the right ventricle all the way to the apex. You want to go and find the pulmonary vein on the back side of the heart and do the exact same thing. You're going to be cutting through the left atrium, through the left ventricle, all the way down to the apex of the heart. So basically, I've almost split my heart into two pieces. The reason I don't want you to pull it off yet is because I want you to see the valves themselves. The valves are very difficult to see, but are because they're very tender, and usually when you cut through the heart, you actually sever those valves. If we were to open up our right side of the heart, again, this being the right ventricle, this being the right atrium, we're going to see something. We're going to see this little cord-looking item that I'm pointing to with the red pointer, and it attaches to a flap. Here is another one of those cords attaching to another flap down in this area right here. What you're actually looking at is the valve between the right atrium and the right ventricle. One of the things that people don't realize is how tender and delicate these flaps are. It's one of the reasons we should take care of our heart, because it is nothing more than a fan-like flap that prevents blood from backflowing through the chambers. Let me turn the heart over and show you from the left side of the heart the exact same thing. If I were to open it up, you are again going to see the cords that right here that are connecting to the flaps. That is the valve between the left atrium and the left ventricle. It's better to look at them like this before you open your heart all the way up. Otherwise, you will never see how they connect and how they fit between the chambers. Once you've identified these structures and understand where they are, it is okay to cut your heart completely open, which I have done here, and basically made a half heart. Now, I want to orient you again. You are looking at the anterior side of the heart. So this is going to be the right ventricle. At the top, up in here, this is going to be the right atrium. On the other side, across this big divide here called the septum, we are going to see the left ventricle, and at the top we will see the left atrium. So there's your orientation of the left atrium through the valves down into the left ventricle. On the other side we have the right ventricle here through the valves, and then there is the right atrium. What I want you to see while we have this model open is to look at the internal chamber of the atrium and look how thin the muscle layer is on the atrium itself. Very thin muscle. But now look down at the ventricle, how thick the muscle is on the ventricle. That is because the atrium is not having to squeeze blood very far. It's just basically dropping down. Whereas the ventricles have to pump blood out of the heart to other areas of the body. The other thing that really stands out is look at the difference in the thickness of the right ventricle wall, muscle wall, versus the left ventricle muscle wall. A lot of difference in that thickness. There is a reason for that. The reason is, remember, the right ventricle is simply pumping blood to the lungs, which are right next to it, whereas the left ventricle has to pump blood throughout the entire body. Therefore, it requires thicker muscle in order for that to occur. I have picked a different model. Basically, it's the half heart that we had earlier, but I've inserted a bunch of pipe cleaners in it for a purpose, because I want to show you with these pipe cleaners the flow of the blood through the heart. So let's take a look at that flow one more time while we're looking at this heart that has been dissected in half. Remember that the blood enters from the body through the superior and inferior vena cavas. Basically, if I were to turn the heart over, you're going to see this little pipe cleaner going through the superior vena cava. If I flip the heart back over, we can follow that and see that the superior vena cava goes through the right atrium, down through the valve into the right ventricle. Once it's here, the heart pumps. When it does, it pushes the blood out through the pulmonary artery. Here's a piece of the pulmonary artery sticking up here, so you can see that the blood goes from the right ventricle through the pulmonary artery. Remember, from there it goes to the two lobes of the lung, where it gives off the carbon dioxide and becomes oxygen rich and returns to the heart. It returns to the heart through the pulmonary vein. If we were to turn our heart just a little bit to go more to the anatomical left side, we will see the pulmonary vein opening right here. As we turn back around, that pulmonary vein empties into the left atrium right here, flows through a valve right there, and comes down into the left ventricle. The blood from the left ventricle then is going to be pumped through a valve here called the aortic valve, and that valve sends it through to the aorta at the top. This is one branch of the aorta. There's another branch of the aorta. From there, the blood goes both to the head and neck and shoulder region, and it turns and goes behind the heart and brings oxygenated blood through the descending aortic artery to all of the tissues of the body itself.